Hi, I'm Dr. Eric Westman, and this is the Keto Made Simple podcast.
I wonder if we have a good cohort of folks on. Why don't we just start out and introduce yourself and how you got into the keto and it's a fascinating story.
Sure. So I'm a psychiatrist, and I've been a psychiatrist for 25 years now. And for the first 10 years of my career, I practiced the way most psychiatrists do. So I was trained to think of mental health problems as having biological root causes that had to do with chemical imbalances in the brain, and that I was trained to treat those root causes with medications. And I was trained to treat the psychosocial root causes of mental health problems, things like stress and trauma and your mother. I was trained to treat those problems with psychotherapy. And I still use both of those tools in my work, even now, every day. They're both very valuable and have their place. But about 10 years into my career, in order to try to solve some of my own health problems that started popping up in my early 40s, some of which a lot of my patients also had, things like, fibromyalgia and chronic fatigue and IBS and migraines. And I just thought, well, I'm just getting older and this is normal. This is supposed to happen. You're supposed to just fall apart when you turn 40. But
No, no.
I know, right? It's really not supposed to happen. So I was working at Harvard at the time, and I had access to lots of really smart and caring doctors and specialists, and I had every test in the world, and they all told me nothing was wrong, and but of course something was wrong, and I really didn't want to take medications because I'm very sensitive to medications. So I just, one of the issues I was having was having to do with stomach pain, and so I thought, well, maybe it's something I'm eating that was causing the stomach pain. So I just started experimenting with my diet, just kind of instinctively. Food symptom journal. I mean, this was back in 2007, 2008, so a long time ago. I had never heard of keto or paleo or anything. So I just started experimenting with my diet to see if I could, help my stomach feel better. Kept a food and symptom journal. And by the end of 6 months, by changing my diet in these various trial and error ways, everything improved, went away, including the migraines, the chronic pain, everything, not just the stomach pain. But the thing that was so fascinating to me as a psychiatrist was my mental health improved too. And I wasn't even trying to improve it. I didn't think I had a lot of trouble with my mental health, although, kind of depressed in the winter, and I was kind of an anxious person, and prone to stress and that sort of thing. But I mean, it was unbelievable. My concentration was razor sharp, my energy stable, good work stamina, much more productive, slept better. I mean, my mood, my concentration, everything was better. And I thought, this diet seems to be good for the brain. And wouldn't that be something if something about this diet could be useful to all of my patients, most of whom weren't getting better enough with the standard tools I had in my toolbox. But because the diet I'd switched to was pretty unorthodox and was definitely not recommended by nutrition authorities, it was really mostly is like a lot based on animal foods. It was a high fat, high cholesterol, mostly animal foods, a few plant foods, but it was lower in fiber, higher in fat, and higher in animal foods than we are recommended to eat. And so I thought, this diet feels amazing, but I can't recommend this to my patients, because what if this diet's going to kill me? I mean, this is what I was taught. So what I decided to do was study nutrition, and really for the first time, because as you know, doctors aren't taught about nutrition. And so, 4 years of medical school, we had about 3 hours worth of nutrition education. And then in psychiatry residency, another 4 years, psychiatry specialty training, we didn't talk about food once. And so I had to really educate myself, as so many of us have had to do, about the truth about how the body, what kinds of foods the body needs, metabolism, what the brain needs to thrive. And I studied for years, several years, independently and in school.
So
Yeah.
let me see. So you didn't really know that you were doing an Atkins diet?
Well,
Well,
along the way, my mom had lost 90 pounds on the Atkins diet. And so I knew that that was something that one could do to lose weight, but I wasn't at that point trying to lose
okay.
weight.
But
So yeah.
by process of elimination with your own sort of detective work, you ended up with something very similar. It reminds me of a story of a doctor who was diagnosed with diabetes, and he reasoned that he should just take the carbs out, and his wife told him, dummy, you're doing the Atkins diet. There's something about, like, we all have to come up to our own conclusion about it,
Exactly.
Yeah.
Yeah. So that, I mean,
So,
that's how I got into it. Yeah.
but so that conundrum of what do I do? How do I deal with my patients is again fascinating, because there are a lot of doctors who are eating this way in the closet, and I just say, well, say you're doing the Mediterranean diet to other health people, and they'll say it's great, that's so good for you, and then they don't ask you anything else because they don't really know what a Mediterranean diet is. Nobody really does. So how did you then? What was the process for being able to use it with or have you used it with patients then? Yeah, I'm sure you.
Oh, yes. Oh, yeah, for sure. So, I was working at the Harvard University Health Service at the time, and the director there at the time was very supportive of the psychiatrists on staff. We were all hired, of course, primarily to prescribe medications, and therapists were prescribed to do the therapy piece of the work. So we were primarily hired to prescribe. But the director at the time was very supportive of us also, nurturing and offering other options. And so, for example, there was somebody on the staff who was interested in acupuncture, and they were allowed to do a little acupuncture. And so I was allowed to do some nutrition consultations, which I really enjoyed. And so I started weaving nutrition principles. I mean, really just at that point, kind of whole foods principles, and lowering sugar and that sort of thing, cleaning up the diet. And then gradually, the more I learned about nutrition and the brain, I stumbled upon a paper about the ketogenic diet for bipolar disorder. And, it suddenly all these light bulbs went off in my head. I mean, this was a long time ago, probably 2009. And it was these similarities between bipolar disorder and epilepsy, because we use the same medications to treat both. We use the same medications to treat mood swings as we do to treat epilepsy. And the ketogenic diet had been used to treat epilepsy quite successfully for about 100 years. And I thought, well, if this diet works for epilepsy, I wonder if it could also work for bipolar disorder. And that just really got me interested in not just the nutritional parts of the diet that can help with brain function, but the metabolic piece. What happens when you go into ketosis? How does that change brain chemistry? And that's about 12 years ago now that I stumbled on that.
Yeah, well, that once you see it, and the other kind of phenomenon that I'm here is that most doctors try it in themselves first, but this then becomes a slow process. If every doctor has to try it themselves first, so I try to leap to, no, it's like an FDA approved drug. So you don't have to go through it and try it. And in fact, you don't even have to do it as a doctor, because everyone else has studied it, and you can just prescribe it. But it's common, I think, for those of us who will write about it and teach about it to have had to try it ourselves, test it, kick the tire, so to speak. So, well, I wonder can you share some kind of success stories that I remember at the Metabolic Health Summit. There have been some people put on stage who just have unbelievably hard lives. I mean, with the psychiatric problems, they're homeless, and then they're like holding jobs and look like they never had any problems. Have you had kind of transformations like that in your practice?
Lots of them, and I put some specific patient stories in the book that I just finished writing, so people can hopefully be inspired by those. So I'm a general psychiatrist. I treat only adults, so I see all kinds of different people with everything from ADHD and mild depression to severe mental illness and early Alzheimer's. And so I have been using ketogenic diets and other types of nutritional strategies in my work for more than 10 years now. So I've treated lots of people with different dietary approaches, but the cornerstone of my practice has been the ketogenic diet, and because that's really the most powerful intervention we have to re-energize, heal, and protect the brain. And so, which is exactly what you want to do if you have a mental health issue of any kind, really. So I've had think of different examples. So a woman with early Alzheimer's, she'd actually had mild, she was in her late 60s, she had mild cognitive impairment for about 20 years. And from a head injury, a mild head injury. She was on medication to control seizures and had mild, some trouble with her memory and finding her car in parking lots and following directions to work and that sort of thing, and eventually had to give up her job because she wasn't able to manage with cognitive impairment. But the cognitive impairment was really stable for a long time, for nearly 20 years. But then, as she entered, was kind of approaching her 70s, there was a decline in her cognitive function, and it was noticeable to her. She went to sit down at her sewing machine that her mother had given her and she'd used for decades, almost every day, and couldn't remember how to thread the machine. And she was terrified. She was like, okay, this is it. I knew this was coming. So she went to her doctor, and her doctor, because I didn't know this patient at the time, went to her doctor, and the doctor said, oh, well, you tested her and saw that the decline on testing, and said, this is Alzheimer's. I just, and there's really nothing we can do about it. So I, just go and enjoy your life. And I'm going to make an appointment for you with a neurologist to do some testing, but this is what's happening. And so the neurology appointment was 10 weeks out. And so while she was waiting for that appointment, her son, who was working with me on bipolar mood issues with a ketogenic diet, asked me if I would see her. So I met with her, and she was very excited to try a ketogenic diet. Gave her hope when I explained how it could help re-energize her brain. And I said I didn't know, whether it would help or not, but it was worth a try. And so she was very interested in doing it. Had the support of her son, who was doing well on a ketogenic diet. And within 2-3 weeks, she markedly improved. She was able to remember directions to go to find her way in her car without even having to write them down. She, of course, could sew again. She wasn't losing her train of thought in the middle of sentences anymore. I mean, she felt that she'd gotten her brain back. And by the time she got to her neurology appointment, they said, there's no diagnosis here. Everything looks fine. You've scored,
Wow.
and this was, and you can see this. You can see really remarkable improvements, not in all patients, of course, not in all cases, but in my experience, I've worked with hundreds of patients, different diagnoses. You almost always see a noticeable degree of improvement to some extent. Some people improve all the way. Some people improve partly. Some people are able to come completely off medication. Some people are able to reduce the number or type of medications that they're taking, the dosage or the number of patients. And so it's, in my opinion, always worth trying. And there are very few reasons not to try it, which we can talk about, those. But it's a really useful intervention, almost regardless of the diagnosis that you're dealing with.
Well, not being a psychiatrist myself, I am struck by, internal medicine has its own issues, but with calling things, labeling things. In our first case that I recall, I was treating someone for obesity, for weight loss, and she came back saying her voices were gone after 8 days, and I was struggling I didn't even know she had a long history of schizophrenia. So although when we tried to publish the case study, and we did, they said, well, she didn't really have schizophrenia. It was a more complicated, and I was sort of struck by, I don't know that the labeling is all that perfect, right, for psychiatry, and so some people ask me, well, okay, it's for schizophrenia, but what about this one, or I have this diagnosis, that diagnosis. It seems to me that because of the imprecision of our ability to label mental health issues, that it would be worth trying a keto diet kind of regardless of what the diagnosis is. Is that kind of your experience?
Yes, because exactly as you say, we don't have diagnostic precision in psychiatry. There are lots of different types of brain health problems, and they can manifest in different ways. So most people with depression also have anxiety. Most people with anxiety have depression, and there are different degrees of bipolar disorder, from mild mood swings all the way to severe bipolar type 1 with true episodes of mania. And there are different degrees even of psychosis, and so everything, just as in all of biology, exists on a spectrum. So when you're and everything's overlapping. It's not like there's one part of the brain that's devoted to schizophrenia and one part of the brain that's devoted to ADHD. Almost everyone with any psychiatric diagnosis has problems with concentration. And so, do they all have ADHD? No, they've got a disruption of their attention system, which is widespread throughout the brain. So these are really just crude terms that we use to try to put people in boxes, and most people don't fit neatly into any of these boxes.
Well, so I often think, well, what a great opportunity. There's so many people hospitalized with psychiatric illnesses and mental institutions, and no one's, to my knowledge, no like formal state institution has ever tried putting a ward on a diet like this. But then there was this Dr. Albert Danan. How did you run across Dr. Danan? Because
Wow.
he did have people he knew put him on a ward, and tell us that story.
Yeah, and so you and I worked very closely on this, and helping. This is my friend and colleague, Dr. Albert Danan. He's a psychiatrist in Toulouse.
Oh, I apologize for the pronunciation.
Oh, no, I don't speak French at all, and I know you do. But I do know how he says his name. And so, yeah, but it looks like, if you were reading English, it looks like Albert Danan, Danan. That's how it looks in English.
Yeah.
And so he's a psychiatrist in Toulouse, France, and he's been a psychiatrist for 35 years. And he, has been working primarily with people with serious chronic mental illnesses of, North African and French descent for a really long time, very dedicated, and, using medications and psychotherapy, and, really gets to know his patients and works closely with them over time. Some of these patients he's known for 30, 35 years. And so what happened was, there was a family member of his who had autism and epilepsy. And that family member started a ketogenic diet, and within a few weeks, the seizures disappeared, and even the autism improved to a significant extent. And so when he witnessed that, he thought, again, this diet seems to be good for the brain, and wondered, if this diet might help so many of his patients who weren't responding well to medications, who really hadn't gotten much better despite all of the work he was doing to try to help them, all the medications and everything. So he invited 31 of his most treatment-resistant patients with bipolar disorder, major depressive disorder, and schizophrenia, if they be interested, to try a ketogenic diet in the hospital under his close supervision, psychiatric and medical supervision. And so 31 of them agreed to do this. And as you know, because we published the paper together, we helped him publish his findings, which are really extraordinary, is that with the exception of the 3 people who were not able to follow the diet for longer than 2 weeks, all of the 28 patients who did follow the diet for longer than 2 weeks, every single one of them improved, and improved substantially. And 43% of them reached clinical remission simply by following a whole foods ketogenic diet that was based on the diet that you've been studying at Duke for so many years. And so this was really remarkable. And, about 2/3 of them left the hospital taking less psychiatric medication than when they went in. And of course, their metabolic health improved as well. So, triglycerides dropped like a stone, and blood sugar came down, and blood pressure came down, and people lost weight. People lost a significant amount of weight, even though almost all of them were taking antipsychotic medications that are notorious for causing stubborn weight gain. And so this was really remarkable and had never been experienced before. Nobody had ever, put a group of people in the hospital and put them on a ketogenic diet. And so he had done this simply to help his patients, not to run a study. And but when he called me and told me what he had done, he reached out to me because he knew that I was interested in this topic. We had never met each other. And he just kind of mentioned it, casually. And I said, "You did what? I mean, this is, do you realize that nobody's ever done this before?" And he said, "Really?" And I said, "No." He said, "You haven't done this?" I said, "I haven't done this." And he said, "Dr. Palmer hasn't done this?" I said, "No, Dr. Palmer hasn't done this." He said, "Really?" And I said, "We need to find a way to publish this and share this with other clinicians so that they know that this is safe," because we found that it was safe, and that it was feasible, and that people got not just a little bit better, but 7 to 10 times better than they tend to do in medication studies for depression and psychosis. The magnitude of the effect was really big. So it was amazing, and I really cannot thank you enough for helping us publish that work, and I hope that will be helpful to other clinicians.
Yeah, well, I've observed other cases and other doctors doing things, but the remarkable thing that Albert did is that he used systematic questionnaires that were validated. Validated was the term I was trying to find. Validated questionnaires all along the way. So there was, and there were multiple questionnaires that got at the same issue. So even though, how do you measure psychiatric illness and all that? Well, it was really well documented. Yes. And as a clinician doing that, I thought that was just really outstanding and remarkable, and also, like you, publishable. And now I wonder, has that paper gotten some traction? We haven't really talked since the publication and all, or is anyone else battling? Well, wait, there's this thing called metabolic psychiatry. What's going on?
Yeah, so this paper, we were so heartened to see the response to this paper, because there's something called an altmetric score, which is just a measure of how much attention people are paying to the paper. And this is among the top 1% of papers that this journal, and any division of this journal, has ever published.
I didn't know that.
Yes.
Oh, yeah. Congratulations.
Yeah, the altmetric score is like 1750 or something like that. It's really, really high. And so it's been a lot, and it's been viewed almost 100,000 times now. So people are really, I think it's resonating. I think the information is resonating. And of course, there's now this field called metabolic psychiatry, which this paper is, helps to fuel new research, helps to convince funders and grant makers that, what, this is a safe and really high, like low risk, high potential benefit intervention that's worth studying more, sort of more rigorously.
Yeah, and there were a couple conferences this year on metabolic psychiatry and integrative medicine. I was on that one, the integrative medicine, and then I didn't make the conference earlier this year that was funded, but it's called Metabolic Mind, the website, I believe, and that's the Bazuki family. I think that's how you pronounce it.
Yeah, it's the Bazuki family.
Yeah. Do you know much about that? I've just watched the video. It looks like their son was greatly improved and then they have some wealth to be able to give to the field. Is that right?
The Bouzouki family, I cannot say enough good things about this family. Everything that they have given, not just financially, but in terms of, you know, what they've donated in terms of their time and energy and personal resources and generosity of information. You know, they've shared their family story, which is a very painful,
Yeah.
but also
Yeah.
very inspiring story. And so this is, I'm talking specifically about Jan Allison Bouzouki. She's the president of the Bouzouki Group, and you know, which is a philanthropic organization that that she and her husband David Bouzouki founded to really promote, like, educate people and do fund science, fund scientific research in metabolic psychiatry, different, like, new approaches to mental health conditions, because their son Matt Bouzouki was had his college career interrupted by severe psychotic illness, and was for a time homeless, and you know, the family was really, of course, distraught and traumatized by his experience.
Yeah.
So eventually, after many medications and many doctors, his mother, Jan Allison Bouzouki, heard about ketogenic diet for mental health, and she sought out the support of Dr. Chris Palmer, who is a psychiatrist here in Massachusetts at Harvard, and he and Denise Potter, who's a very experienced dietitian, keto dietitian, put him on a ketogenic diet, and within about 4 months, his illness went into remission, and has remained in remission for, I want to say, what, at least 2 years, or maybe 3 years now. And so he, if people are interested, he and Dr. Ian Campbell, who's now a prominent researcher in ketogenic diets for bipolar disorder, they have a YouTube channel called Bipolar Cast, where they interview people who have, you know, gotten better on a ketogenic diet. It's a really great YouTube channel.
And I didn't know that it took 4 months.
Yep.
For the one case that I had, sort of the index case in my clinic, it was 8 days. So
Right.
that's important to know that there's some variability in how much time it might take. And yet sort of the unknown to be discovered is what percentage of people respond. Kind of like in your practice, your gestalt is that it's not going to be the same for everybody, right?
No,
there may be
definitely
responders and non-responders, but you know, why wouldn't you try this? You know, and I really, yeah, thanks again. I want to shout out for everything that the Bouzouki group has done, and I saw Ian Campbell's talk at the Integrative Medicine conference, Integrative Psychiatry, and he was measuring himself with ketone levels and symptoms.
Mm-hmm.
And that was really the first time that I've seen the correlation between the higher the ketone level, the lower the symptom. Now, of course, this is one individual, and it's you might even say you're susceptible to placebo effect, you know. So, but again, the knowledge that can be gained by measurements of ketones and breath, blood, or urine, and then subjective scores, it's really not difficult to do this intervention and to test this out. It's just getting the engine of research and people who are in power of in control of research studies to get them on board. Yeah, and then, like you said, to have Dr. Danin's inpatient experience will open the door for other people to want to try it. Although I fear the resistance, like in internal medicine, is that everyone looks to medications in internal medicine, and everyone looks to medications in psychiatry as well. I mean, that's the last,
That's
you know,
true.
our career, right?
That's
So,
true. But you know what occurred to me? I was giving a talk at in Switzerland. There's a conference called Food for Thought, and this year they decided, just this couple of months ago, they just decided to include multiple talks about metabolic psychiatry because it's such a new and exciting field. And I was up there talking, and it occurred to me, because there were several talks also about obesity and type 2 diabetes and how these new medications are coming along now that everyone is so excited about, that can actually, they do help, they can help people lose weight, and they can help, control blood sugars and things like that. And for a long time, we've had medicines that can help control blood sugars. And it occurred to me that there's even a stronger argument for using the ketogenic diet in mental health disorders than there is for almost any other disorder, because we don't have great
good
medications
medicine.
in psychiatry.
Yeah.
The medicines we have are really limited, and at best, the best, most reliable psychiatric medications, which are the antipsychotics, they only help about 25% of people. And so,
I
what
think
else are we going to do?
that's an underappreciated reality. And even some of the medications, when you look at placebo-controlled trials, they don't work at all, and yet they're being used. And but on the other hand, what a great time to be able to study it, use this clinically. I did. Let's see, John, one of my people on the call tonight asked about for the name in the paper. I'll post a link at the bottom of the video, so you can just click there. Do you remember the journal?
I do, and in fact,
You have it right
I
here.
have a copy of the paper right here.
There you go.
So, the ketogenic diet for refractory mental illness, a retrospective analysis of 31 inpatients. It's an open access paper, so anybody can read it. And you can even if you click on the supplemental materials button, you'll find a description of the diet that was used. And I have some of my patients actually put that on their refrigerator so that they can remind themselves what to eat and not eat.
Yeah, well, that was a fantastic find, so that you were approached by a doctor who'd done this work. And I think it's really important for so many people to be around and be accessible. I could imagine that person would call the professor in charge of psychiatry department chair at Harvard, and they would say, they wouldn't pick up the call, right?
Well, I feel very fortunate to know him for many reasons. I mean, he's just a wonderful psychiatrist, a wonderful doctor, a wonderful human being, and just a lovely, lovely guy. And he's nearing retirement now, so he's really, he's not particularly interested in, going around the world and sharing this information. So I'm more than happy to do that for him.
Fantastic. But so I wonder, let's switch now to your book, the book coming out, and what possessed you to go through that pain and agony.
Well, as you've written many books, it is painful. And I was joking with my friends, because it took a huge chunk out of my life. I was joking with my friends, this book is, if this book is killing me, and it's probably going to need to be published posthumously.
No.
And it was just a lot of work. I had no idea how much work, but it was a joyous, it was pain, and the best of times and the worst of times, right? So it was a lot of work, but really what drove me to do it was I was just possessed by this desire to, it's kind of frustrating to, help one person at a time, and, teach one person at a time. And when there's so much information that everybody needs, and a lot of that information they can put to use right away without a lot of special help. And there's just some great basic changes that people can make, even if they don't use a ketogenic diet per se. There's so many myths about what a healthy diet looks like, what the brain needs, which foods are good for the brain, which foods are bad for the brain. It's all upside down. And so what I did, what I was really driven to do in this book, was to put all that information in the same place. So not just, okay, what should you eat for a healthy brain, but why? So why am I recommending these things that fly in the face of conventional wisdom. And for the people who really are, picky about the science, there's plenty of science in there to back up these arguments. And then there's also a lot of practical advice as well. So, and all the way down to, recipes and meal plans and how do you
great.
test insulin resistance and everything. So it's kind of half science, half practical.
And the title is Change Your Diet, Change Your Mind,
Yes.
which we have a saying, change your food, change your life, sort of a similar, and of course, adapt your life, meaning, every organism that is able to survive has to learn to adapt to new situations. And so I like that similarity. The how to, or the intended audience is the general public then?
It's for the general public as well as nutrition professionals and clinicians. So it speaks to both groups of people, and that's on purpose, because if we speak just to patients and we don't include enough of the kind of deeper science, then the clinicians and nutrition professionals will poo-poo it. If we speak just to the clinicians, then it doesn't help everyday people who are looking, for information about how to improve their mental health. So it was really aimed at both groups.
And so the book is available for pre-order. Is that right?
Yep. So it's available for pre-order now. It will be released on January 30th. But we're going to come out with, we really, for people who are interested in pre-ordering it now, we are going to be sharing some special incentives, so while you're waiting. And one of the things, because I'd really wanted the book to come out like right at the beginning of the year, so that people, because people are really inspired to change their eating habits, and after New Year's, but that just wasn't a date that the publisher could accommodate. So I thought, well, how can I help people during that interim to get motivated? And so we're going to create this. We're going to create what's the word I'm looking for? A resource while people are waiting for the book to come, that helps them get ready to make those changes. So what kind of lab tests should you get? How do you get your clinicians involved and on board? How do you start to sort of reorganize your kitchen and your pantry for healthier eating? All of these steps that you can take to get yourself ready. And then when the book comes, you can get started right away, because it is important to prepare and to take your time preparing so that you set yourself up for success.
Recently in the clinic, I was asked how someone can find a doctor, psychiatrist who's keto friendly. Is there a resource for that now yet?
I'm glad you asked. So in the past year, maybe 8 or 9 months ago, I started on my website, completely free public resource. It's a clinician directory, specifically listing. Yeah. And I can put the link for people, or you can. I'm not sure how that works, but on my website. So my website is called Diagnosis Diet. And on my website, Diagnosis Diet, there's a tab called directory, clinician directory. And if you click on that tab, you'll see you can search by country, you can search by, if you're looking for prescriber. And we've got about 150 clinicians there so far. This is specifically for mental health only.
Got it.
So we kind of curate that. People will submit their listing, but we will only post them if they treat mental health conditions and they have that expertise. So, and it's, prescribers, but it's also nutrition professionals and therapists and coaches and so different types of providers.
Well, so I was trying to catch up on everything you've been doing, and you've also have a training program for clinicians. Is that right? Tell me about that, please.
Yes. So about 3 years ago now, maybe more, I developed a clinician training program that's, continuing education certified, because people need access to professionals who will support them in a safe and knowledgeable way to transition to a ketogenic diet. And especially if you're on medications of any kind or have serious mental health symptoms, you really need to work with somebody as you transition to the diet, not because the diet is dangerous, but because navigating the medications and any existing health issues, especially when your body is shifting gears, just takes a little special knowledge and skill. And so, and there are very few of us who were doing this a few years ago, just a few of us really in the world. And so that, well, this, people are emailing me every day saying, can I see you? Can I see you? I was like, oh, gosh, I can't help everybody that writes to me.
Right.
We need more people. So I decided to train other people. And so we've trained hundreds of clinicians around the world and continue our trainings every month. And so this is continuing education certified. And for clinicians of any background, you don't have to be a prescriber, although we love prescribers because they're the ones who are most, in need, that people, we're really trying to improve access to metabolic psychiatry services. And the Bazuki group is trying to help us in that regard as well, trying to make the course more accessible.
Fantastic. How do you do all this? That's what everyone asks me that too. Well,
right. I mean, it's a lot of work, but it's a passion project, right? I mean, it's just, it's a calling, really. I mean, it's a strange word to use, but I can't explain it otherwise because it's, I've invested a lot of time and energy and my own resources into doing these. A lot of these projects are not profitable, but I really am doing it because I love it. And I was trained conventionally, and the typical treatments, they just don't help most people. And we need a better way.
Well, I was reminded, we have had the chance to spend some time together traveling and all that, and I'm reassured because there are still a few of us who still care about people getting better.
Yes.
And it does become a calling, almost, it's almost like the clergy, the medical doctors, not everyone, but there. And I'm glad that you're one of those. You've been very productive.
I'm glad that you are too. And you'll see this when you get your galley copy of the book, but I made a point to acknowledge you in my acknowledgements because your work has been such a foundation for my work. And you're one of the pioneers in the field, and we wouldn't be here without you. So I really appreciate everything you've done and continue to do for all of us.
Well, and I thank you. And all that we did here at Duke is to formalize what Dr. Atkins and all the other, Dr. Eads and Rosedale and Bernstein, but that was an important step to gain the credibility, the ability to have a worldwide group of contributors in a really amazing text. And I guess it went from doctors writing books about it to now studies being done, so that there's a classic book that Dr. Atkins wrote, Dr. Atkins' Health Revolution, and that became sort of my roadmap of what studies to do. Because he wrote about fixing GERD and heartburn, and but he didn't write a whole lot about mental health, which is pretty interesting. But he was a cardiologist internist at the time. So anyway, I see this as a necessary transition for the credibility. Now we need to just get it to catch on. And I think what I'm seeing is this in your approach, it's grassroots as well, because you're not, for example, targeting the NIH or the American Psychiatric Association, because kind of like in my world, they're so entrenched in either finding a mechanism or a new drug that we've had to just build up from the grassroots. It seems, is that kind of what you're surmising in the mental health world too?
Yeah, I think it's going to take, I think we need a combination of grassroots and, kind of higher level changes. We've put in 2 submissions to the American Psychiatric Association meeting for this coming spring on metabolic psychiatry. And so hopefully at least one of those, of the 2 that I'm involved in applying for, hopefully at least one of them will be accepted. because, that's a huge meeting, as you know, like thousands of psychiatrists around the world come
Yeah.
to that meeting. And, we just need to get the word out, because I actually think that most psychiatrists when they hear about this intervention, get really excited, because
Okay.
most psychiatrists are frustrated
Yeah.
that they have nothing left to offer some of their patients. And they love to have new tools, so I think it's a really exciting time to be a psychiatrist. Something new is happening.
Switching gears, I wanted to just pick your brain a little bit about your experience in using keto diets. Is it in the implementation? Is it different for mental health conditions or for the metabolic conditions like diabetes and obesity? Or do you look at it differently or more similar than different?
It's more similar than different. There are a few special challenges. This is one of the things I teach in my training program is, even clinicians are coming to the training program already knowing a lot about ketogenic diets for, things like obesity and type 2 diabetes. There are some special things they need to learn to use those same skills to treat mental health conditions. And one of them is that, people with mental health conditions, those mental health conditions, those symptoms, whether it's depression or difficulty concentrating or feeling disorganized, being impulsive, any of the, lots of those things can make it harder to change your diet.
Okay.
So it's just an extra obstacle. But then also the medications, some of the psychiatric medications cause insulin resistance and make it harder to get into ketosis. And so you often need to be stricter with the diet in order to get people to transition. And there are also there are some other challenges. For example, if people have cognitive impairment, because I've worked with quite a few people, older people with cognitive impairment, it's really hard for them to learn new diet rules. And so it takes some extra time and some extra patience and some extra visits to implement those changes. And the other thing is that, and this is pretty important, is that when you're transitioning to a ketogenic diet, unless you do it very slowly and carefully, you can cause somebody to feel worse before they feel better psychiatrically. So they may feel more depressed, more anxious. They may even experience what's called hypomania, sort of mild manic symptoms, like high energy, uncomfortable, high energy state, as the brain is seeking its new equilibrium. So this usually, when people do feel worse, it usually resolves by week 3. But that's why it's so important, especially when medications are involved or when someone has a history of dangerous symptoms. Because if any of those get worse, that could be a real problem. But the medication levels of certain psychiatric medications can change as the body chemistry changes. People can start to feel more sensitive to their psychiatric medications in the first few weeks. So it's really navigating those first few weeks, which is where a lot of the skill and knowledge comes to bear. And it really is, once you get to the other side, once your body has reached its new equilibrium, which can take anywhere from 3 days to 3 weeks to 3 months, depending on who you are, but on average, 3 to 6 weeks, then what most people experience is a very different state of mind than they're accustomed to. Most people will say, oh, I've never felt like this before. Like, this is something completely new.
Well, it kind of cries out for the inpatient use and starting a diet on someone who's severely ill. I thought that would be necessary for someone who's on 10 different medications for diabetes, high blood pressure. I have to backpedal, get people off the medicines. It would be safer if they were in the hospital. I wonder if the Dr. Danon's model of hospitalizing people with psychiatric illness to start people out could be a way to get people through that hurdle.
Yeah, I mean, I think in some cases that would be a good idea, depending on the particular circumstances. Because if someone is in fragile mental health, they're already unstable, if they're already, dealing with, say, suicidal ideation or self-injury, agitation, you certainly don't want that to get worse. So in some cases, I think that would be a really good idea. with what Albert did with his patients. I mean, he's a very skilled psychiatrist, so he could adjust psychiatric medications himself, but he also was trained in psychosomatic medicine, so he has internal medicine skills. And so he was able to adjust the diabetes medications and the blood pressure medications himself. So that's just a special circumstance, right? And he was in France, where they let you stay in the hospital as long as you want. So we in the United States, don't, we kind of frown on that. But yes, I think in some cases, yes, but in most cases, no. I think, and I'm an outpatient psychiatrist, but I think if you transition slowly, if you pay attention to the medications and you monitor things and you work closely with the other clinicians, you can do it safely. But you need to know what you're doing.
Along those lines of implementation, I'll never forget a lecture you gave, and thanks for all you've done in teaching at our meetings through the years. There was a meeting, I believe the title of the talk was The Psychology of Subtraction. and it opened my eyes to the fact that, well, what does that mean?
So, really, I think one of the most, we're always told, and there's a lot of this in the book, we're always told that the way to protect our brains is to add more things to our diet. So add special superfoods like blueberries and red dark chocolate and red wine. Ridiculous, red wine. That's psychiatric malpractice to recommend wine to people who have depression and cognitive impairment. But in any case, we're told that you should add superfoods and supplements and eat these special things. And there's absolutely no science behind any of those recommendations, which is one of the things I talk about in the book and explain why there's no science behind these things. But anyway, really the most powerful interventions. So when you add things, I mean, everybody finds it easy to add things. It's easy to add things. It feels empowering. It feels positive, and it's exciting and new. Nobody wants to subtract things from their diet, and that's where the power is. Because taking things out of the diet feels negative. It feels depriving. It's harder. But it is really some of the most powerful changes you can make have to do with subtraction. And you will, if you add things to your diet, you will see little to no improvement. And you may even get worse depending on which intervention you're using. If you subtract the right things, you can see benefits within 3 days to 3 weeks. It's really very substantial. So the psychology of that is challenging, though, because nobody makes money telling people what not to eat.
Well, I remember it was very influential for my teaching, because I would not just say you can't have this, get the no list. No bread, no pasta, no rice, no fruit. I totally switched my discussion of the new program to, you can have bacon and hamburgers and all these. You look at all the things you can add in that you thought you could never have again, and I think it made a difference. And the right now I have a list of the foods on the wall and a big poster, and it's very helpful to teach from it. But some people will look up there and their eyes are, oh my gosh, I could never do this. But once I explain that after a day, your hunger's gone, a day or two, the cravings go away, you won't believe it unless you try it. I can usually barter for a day of that, basically subtracting all of those junk foods out. And my approach is really kind of all or nothing on one day, of the mindset that taking a Band-Aid off, you want to do it quickly. There's less pain, but I can see that in certain circumstances, like severe mental illness, you'd want to do it more gradually. And again, as a just caution to reiterate that if you don't have stable mental health, or if you've had difficulties, you want to do this with a doctor who understands how to monitor the mental health, and then to get you off medicines safely if needed. So don't just try this on your own without supervision. it's kind of my caution, even with severe medical illness.
Yes.
You have diabetes, you have mental health problems. You want to do this with someone who understands, is trained in it. And your website having a list, I'm going to be using that. Thank you. I'm thinking that I've kept you long enough. I could answer a few questions from folks listening in live, or do you have any kind of last comments? You got the training program, the website, the book coming out in the end of January. What a great time.
It is a really exciting time because of more resources for people, because we don't have enough resources out there. But yeah, I'd love to answer some questions if you have time. And I just wanted to, you'd said that at that meeting that you heard me say this psychology of attraction, that was the very same meeting when I heard you say, and I even just used this today because it's holiday time. You were saying, when can people go off the keto diet for a day, to Christmas time or birthday, whatever. And you said, don't let a holiday become a holiweek. And yeah. I use that phrase all the time. And I wanted to thank you for that and many other things.
And to be fair, I learned that from one of my friends at the Obesity Medicine Association.
Oh, really?
Who's retired now, but a great teacher. And, I guess this is another reason why we all should get together again in groups as doctors and train, because we do learn so much from each other. And wow, let me know if you get to the APA. That'd be unbelievable.
Yep, we're really
American
excited.
Psychiatric.
We're really excited. So they're both 2 group presentations. So 3 of us, different ones of us on each one. So I'm really excited about it.
That's fantastic. Well, I'm thinking that I've kept you long enough. Thank you again, Dr. Georgia Eid, and with metabolic psychiatry or your website is actually Diagnosis Doctor. Yeah,
no, it's a problem. The name of my website is problematic, but it's because it has nothing to do with anything you've heard. So it's called Diagnosis Diet. But if you just type my name into Google, it'll come up. But the reason it's called that is because years ago, when I wanted to write a book, I thought that's what I was going to call it. And so that's what I named the website, but that was probably a poor choice. But anyway, if you type my name in, which is kind of a unique name, then the website will come right up.
Well, but now that I think about Diagnosis Diet, what you're meaning is that the diet is the culprit. Is that?
Exactly. Yep. The key to the diagnosis, what's causing the diagnosis is most likely your diet. The diet,
yeah. Well, that's so true. And I've been so influenced by the folks talking about addiction and sugar and ultra processed food addiction, and that the food manufacturers, Michael Moss wrote the books Hooked and Salt, Sugar, Fat, how we really are unable to moderate the foods, the frankenfoods, the junk foods that are being made for us. I guess that's another caution for keto junk foods that are out there now.
It really is. It really is.
Yeah. Well, thank you so much. And I really look forward to seeing more of what you're doing. That's just really awesome.
Well, thanks very much for having me. And it's so nice to talk to your listeners as well. And I look forward to seeing you hopefully at a conference soon.
Let's do that.
All right.
Take care now.
Take care. Bye.
Bye-bye. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.